Hello. Today we're doing part 2, questions and answers of psychiatric nursing. Please hit the thumbs up button, please subscribe, and please share this video. All my questions and answers are taken from nclex-rn examinations. My first question is, client diagnosed with delirium states, "Look at those spiders on the wall." What should be the nurse's response? The correct answer is, "I know you are frightened, but I do not see spiders on the wall." Please note, when hallucinations are present, the nurse should reinforce reality. The next question, client is complaining to other clients, nurse will not allow her to keep food in her room at nights. What should the nurse do? The correct answer is setting limits on behavior. Behavior is manipulative. Keep control on dysfunctional behavior. A consistent approach is necessary. This client is manipulative. The next question is, priority intervention for bulimia nervosa is monitor client continuously. Client hides foods or force vomiting is the correct answer. Client diagnosed with schizophrenia says to nurse, "Yes, it's March. It's little woman." This statement illustrates what? The correct answer is loosening of association. It's without logical connections. This is the correct answer. For schizophrenia patients, a part of their diagnosis, they will experience loosening of association at times without logical connections. Next question, correct characteristics of bulimia nervosa is, characteristics of bulimia nervosa is, correct answer, badly stained teeth due to repeated self-induced vomiting causes dental enamel erosion. My next question is, what is the care plan for bipolar disorder? What is the care plan for bipolar disorder? Correct answer, provide structural environment to decrease agitation, to decrease anxiety, and increase patients' feeling of security is the correct answer. My next question is, which action should the nurse include in care plan patient diagnosed with anorexia nervosa? Which action should the nurse include in care plan? The correct answer is set up a strict eating plan for your patient to monitor the patient's weight is the correct answer for patients with nervosa anorexia. My next question, client is withdrawn, neglectful of personal hygiene, diagnosis schizophrenia. It is unlikely that patient will demonstrate what? The correct answer for withdrawn patient, neglectful of personal hygiene, schizophrenia, the correct answer is client will demonstrate. It's unlikely that patient will demonstrate effective self-boundaries. Clients with this diagnosis do not have adequate self-boundaries. My next question, client diagnosed with dementia cannot remember facts and fill in the gaps with imaginary information. Nurse is aware of this, typical of what? The correct answer, defense mechanism of confabulation, filling in the gaps of memory loss. Confabulation, filling in the memory gaps. Dementia patients, they usually fill in the gaps. My next question is, client is admitted with drug-induced anxiety related to over-ingestion of prescribed antipsychotics medication. What would be the most important information nurse should need initially on admission? The correct answer would be name of medication ingested and the amount of medication ingested for patients admitted with overdose on medication. My next question is, a neuromuscular blocking agent administered to a client before ECT therapy, electroconvulsive therapy. Nurse should observe these patients for, and the correct answer is respiratory difficulty. This neuromuscular blocker inhibits contractions of respiratory muscles. So patient with ECT administration, when this neuromuscular agent is administered, you assess patient for respiratory difficulties. My next question is, effective treatment for alcohol addiction. What is going to be your answer? Effective treatment for alcohol addiction is total abstinence is the only effective treatment for alcoholism. My next question. The nurse is doing an evaluation. Patient is going home. This patient is diagnosed with chronic anxiety. Which goal most appropriate should be included in your discharge care plan? The correct answer, the client identify anxiety producing situations. This allows client to prepare to cope with anxiety or to avoid specific stimulus. So client with chronic anxiety, nurse's care plan, evaluation, client identify producing situations. This allows client to prepare to cope with anxiety or to avoid specific stimulus. What is AA? What is AA? AA is Alcoholic Anonymous, 12-step program dedicated in helping alcoholics pair to pair in sobriety. It is spiritually inclined 12-step programs. Nurse can minimize agitation in a disturbed client by doing what is the question. Nurse can minimize agitation in a disturbed client by doing what? The correct answer is limiting unnecessary interactions will decrease stimulation and agitation is the correct answer. Which food would RN eliminate from diet of a client experiencing alcohol withdrawal? The correct answer is regular coffee, which has caffeine, which acts as a psychomotor stimulant, which leads to anxiety, which leads to agitation. My next question, excuse me, my throat is so dry. My next question is, which approach would be most appropriate to use with clients suffering from narcissistic personality disorder when discrepancies exist between what the client says and what actually exists? The correct answer is supportive confrontation would be most appropriate to point out discrepancies between what is and what the client states. These are your narcissistic patients. My next question, client with catatonic stupor is found lying in a fetal position. What would the nurse do? Client with catatonic stupor is found lying in a fetal position. What would nurse do? Correct answer is sit beside client in silence and occasionally ask open-ended questions and pausing to provide opportunities for client to respond is your correct answer for client experiencing catatonic stupor. My next question, during ECT, electroconvulsive therapy, oxygen by mask via positive pressure ventilation is necessary because of what? Correct answer, muscle relaxation given to prevent injury during seizure activity, depressed respiration. Oxygen by mask via positive pressure ventilation is necessary because the correct answer, muscle relaxation agent is given to prevent injury during seizure activities, depressed respiration. The next question is, clients with depression have not responded to antidepressant medication. Nurse anticipate what treatment procedure may be prescribed. Clients with depression have not responded to antidepressant medication. Nurse anticipates what treatment procedure may be prescribed, and the correct answer is ECT therapy. When antidepressant medications, clients have not responded to them, ECT therapy is done. ECT therapy is an effective treatment for depression that has not responded to medication. My next question, client with OCD becomes immobilized by frequent hand washing and walking rituals. Nurse recognized basis of client OCD is often because of what? The correct answer, feelings of guilt and inadequacy. Ritualistic behavior seen is aimed at controlling guilt and inadequacy, and these are for your OCD, hand washing, walking rituals. The nurse recognizes what? And the correct answer, feelings of guilt and inadequacy. Ritualistic behavior seen is aimed at controlling guilt and inadequacy. My next question, what is major signs and symptoms of anorexia nervosa? Major signs and symptoms. Correct answer, excessive weight loss. Amenorrhea, abdominal distension. Next question is, what are the signs and symptoms distinguish post-traumatic stress disorder from other anxiety disorder? What are the signs and symptoms that distinguish post-traumatic stress disorder from other anxiety disorder? The correct answer for post-traumatic stress, re-experiencing the trauma in dreams and in flashback, is the correct answer. My next question is, when teaching patients about childhood depression, what should the nurse teach? The correct answer, it may appear acting out behavior. Temper tantrums may indicate underlying depression. My next question, client is diagnosed with dependent personality disorder. Which behavior is most likely to be ineffective coping? And the correct answer is inability to make choices and decision without advice is your correct answer for client diagnosed with dependent personality disorder. Behavior most likely to Which behavior is most likely to be ineffective individual coping? Behavior most likely to be ineffective individual coping is inability to make choices and decisions without advice. Next question. Client experiencing anxiety attack. The most appropriate nursing and intervention is for anxiety attack. Correct answer, you always stay with the patient. Maslow hierarchy of needs, safety and security. When you see a question, the answer. When you see the answer, stay with the patient. Maslow hierarchy of needs, security. Stay with the patient. Speaking in short sentences. Remaining calm. Administer medication. Client experiencing anxiety attack. Most appropriate intervention is to stay with the patient. Thank you. Hit the thumbs up. Please subscribe. Please share this video. Have a blessed day. My next video follows is on alcoholics and substance abuse.